Hello, fellow Ugandans. My name is Aturwanaho Dickens, a medical doctor at Shibuli Muslim Hospital. I want to talk to us about a disease called hepatitis B. Our community has a misconception about this disease. The challenge with this disease is it has no cure. So our focus is majorly on prevention. So to understand what hepatitis B is, hepatitis itself is what we term as inflammation of the liver. So hepatitis B in particular is an inflammatory disease of the liver caused by hepatitis B virus. This virus can be transmitted from one person to another if they come into contact with infected fluid from a sick person. Hepatitis B, when it gets into your body, it can remain in a dormant state for years. Some people can stay all their lifetime without ever knowing that they have hepatitis B. However, science tells us that 20% of these people that get hepatitis B will always end up getting chronic infection, or they will end up getting a chronic disease. The other challenge is that hepatitis B has no acute symptoms. People will never walk into the hospital having any symptoms and then you diagnose them straight away with hepatitis B. Whenever they walk in, the symptoms that they are suffering from at a point of presentation are actually a consequence of the complications they've suffered from the disease itself. So what we appeal to people is that whenever you go for a medical checkup, one of the things that we should look into looking at doing is checking your hepatitis B status. When you check and you're negative, there is a vaccine that is fully effective and very safe. You get your 3 shots at the time specified by your health care worker and you'll be protected from this. In our communities, when people present to a health care setting with yellow eyes, they always call this in Luganda omusujja gw'enkaka. And most people think this is hepatitis B. It can be hepatitis B, it can be something else. So it's hard to know. So the only best way to understand what is happening to you is to have a checkup, get vaccinated, and you'll be safe.